Okay, hi everyone, and welcome to this week's media briefing. As always, we'll start with a presentation from Dr. Hergy and then move into a time of questions, giving everybody the opportunity for one question and one follow-up, and then if we have time, time for a second question. So I will hand it over to you, Dr. Hergy.
Okay, thank you, Courtney. And everybody is good and sees the slides? Great, thank you very much. So I will start off by just quickly highlighting where things are in the province. Obviously, the province made a significant announcement today based on where they see the situation with COVID-19, and I think it's a good place for us to start. So I don't want to spend a lot of time on it, looking at the overall case trend. We know testing is very restricted right now, and this does not necessarily represent the full number of cases, but we are, at least in the group who is still able to get PCR tested, continue to see a decline, averaging a few hundred, 150 per 100,000 cases a day. It's a little over, on the order of 2,000 cases in the province. I do note that Peter Uni of the Science Table commented last week that he estimates it's probably close to about 30,000 new infections a day in the province, with only a small fraction of those being picked up. So that's, if we think about if we are able to test everybody, we'd be getting 30,000 cases a day rather than the closer to about 2,000 cases a day that we are currently seeing. Nonetheless, at least in the group who is being able to get tested, which is largely groups who have had early access to booster doses, healthcare workers, long-term care home, retirement home residents, we are definitely seeing a decline continuing on in that group, which I think does show that if you're a group who does have the booster dose, you're probably doing pretty well right now, and the risk is definitely coming down. Other data the province is looking at is the test positivity data, which is this orange bar. And it shows that the percent of people who are getting tested is coming down, which makes sense. Nonetheless, I do note that percent positivity, it remains much higher than it was in previous waves of the infection, which is consistent with there still being probably lots of infections out there that aren't being picked up just because we're not able to broadly test. Wastewater data at the end of last week wasn't looking that positive to me provincially. So this is what the province's, the science table, sorry, was estimating as the province's wastewater curve. And you can see it was coming down, and then shortly after the province's reopening, you see the wastewater signal really flattened out, implying that the reduction in infections was stopping and transmission was flattening out. They have updated data today, which actually shows a little bit more of an optimistic trend, where it does look like maybe it has continued to continue going down. This data is only good until about February 4th, though, so I think we still need to see if what they're suggesting is an ongoing downwards trend will materialize. But that's certainly more optimistic than it was looking like at the end of last week. And if we take a look at hospitalizations, we can see the hospitalization numbers are steadily coming down. That being said, the province is probably still around 2,000 hospitalizations a day. I know over the weekend and today they're reporting substantially lower than that, but we always see hospital reporting seems to be low on the weekend and on Mondays, and then middle of the week it rebounds back upward. So I'm going by the end of last week where we're around 2,000 cases, and we are averaging over the last 7 days certainly around that. And that remains higher than we were in either the first or the second waves of this pandemic. A little better than the third wave, but I think it's important to remember that this is still a pretty high number of hospitalizations. And likewise, if we look at our ICU numbers, they're fortunately coming down. And here it's looking a little bit better than the hospitalization numbers, where the ICU numbers are clearly below the first and the third wave, though probably on par with the second wave or even a touch higher than that. And so, our hospitals still remain quite stretched, and I think it is a relatively precarious situation for them. Nonetheless, it seems like the province has looked at this, seen the wastewater data, the percent positivity data. While it still implies a lot of infections, it's going down. Hospitalizations, while still high, are going down. And so they have announced their changes to their reopening framework, where they are jumping ahead from what they previously described was the minimum 3 weeks they would need to wait to see if things were improving. And nonetheless, after 2 weeks, deciding that they're going to move forward with opening up to that next step. And then really only waiting about 10 days before taking the next step after that. Again, not waiting the 3 weeks that they previously said would be needed for them to know whether or not things were trending in the right direction. Today, most capacity limits are decreasing and gathering limits are increasing. And then largely everything else is supposed to go away on March 1st, including requirements for proof of vaccination. It will remain as a voluntary option. One thing they did say would remain past March 1st could be masking in indoor settings. Now, when the science table looked at this a couple weeks ago, they said that with the restrictions being lifted on January 31st, there was a very good chance that this downwards trend in hospitalizations could rebound starting in the mid to late part of the month, and we would start to see ourselves going back up. Where we stand, as I said, we're around probably 2,000 hospitalizations today based on where we were end of last week. So we seem to actually have been lucky and trended along the green scenario, which is the most optimistic scenario. But nonetheless, this scenario does look like it is going to see a rebound in hospitalization numbers. And then, as I noted, our hospitals are stretched right now, and they will remain at that high level of burden for quite a while, which is certainly not going to be easy on our hospitals in order to manage that. So I think that may be where we are headed right now, at least based on the latest modeling by the science table. We may get some more modeling coming up in the coming days, and we can see where that lands. I note the province has moved ahead with the reopening without waiting to see what maybe updated modeling shows. So presumably this is what they are basing their decisions on, that they are moving ahead with hospitalizations remaining at a high level. I also want to quickly note that Public Health Ontario did a review lately, end of a couple of weeks ago, where they highlighted that with reopening, there's really three scenarios that could play out. Resurgence of infections, plateauing of infections, or maybe going with a steady decline. And you can see the risk levels they highlighted and noted that the middle road, plateauing at a moderate to high rate of transmission, was the most likely scenario that would play out. And I think that is unfortunately the scenario that the data seems to be showing, where we are remaining at a high level of transmission, and the science table's modeling says that we are probably going to plateau out at this level. So I think we need to be mindful that that's likely where we are headed. Obviously, with the reopening that has happened, we can start to see the change in people's behavior, where the mobility of people being outside of the home really dropped off over the holiday period and with the social restrictions the province put in place. And as they opened up for schools and it progressively signaled they were going to open up more, we are seeing, of course, people resuming their out of home activities and getting back close to where we were before this latest wave began. So I'll stop there talking about Ontario and just quickly show the comparison of what's happening here in Niagara. When we look at persons being tested, it remains similar to what the province is showing. In that small subset who is getting tested, we are seeing infection or tests coming back positive continuing to decline. We are seeing our percent positivity has come down, though interestingly, we can see that it's sort of flattened out here in Niagara. And of course, it's flattened out at quite a high percentage, which is pretty similar to what the province's percentage is, around 15%. But I know that that 15% is very high. We used to think about 5% being a very high percent positivity. And we're, of course, ending up staying with percent positivity much higher than that going forward. If we look at our wastewater data, this is the Port Weller, Hamilton, St. Catharines, ignoring these couple of big outlier peaks that are really high, there maybe is a trend downwards in the wastewater, which seems to maybe have now kind of flattened out and plateaued. So that's sort of what our percent positivity data was saying. And likewise, when we look at the wastewater treatment plant in Niagara Falls, we seem to have gone down, and then we seem to have plateaued out lately, and we're sort of staying at a kind of flat level. And obviously, this level remains much higher than it's been in previous months of the pandemic. So we are flattening out maybe if there are infections at that high level. And then if we take a look at the number of outbreaks we have here in Niagara, well, we're maybe seeing a little bit of a decline still. It is largely flattening out. And so when I'm looking at this data, it does seem like in Niagara, we are hitting that plateau that the science table and Public Health Ontario warned that we might hit. It seems to be plateauing out here in Niagara, maybe a little earlier than it might do for the province. And I do worry that we are going to end up with a situation where we're living with very high levels of infection, with our hospitals remaining quite stretched as a result. This is the hospital data here in Niagara. Fortunately, has still been coming down. Hospital data probably takes 2 to 3 weeks after what changes in terms of infections and transmission to respond. So I don't think we've really seen the impact of reopening yet. If we're looking at our ICU numbers, likewise trending down. And if we break out the people who are being primarily treated for COVID-19, those hospital trends still are also trending down. So that's good. And then, like the province, if we look at our mobility data here, this is people staying home. Started to stay home much more over the holidays and with the social restrictions. And you can see that has been declining, and particularly with the reopening of some of the public settings a couple of weeks ago, a big drop again in people staying home as people start to go out and about much more. And likewise, if people are, in terms of shopping and recreation, there's a dip over the Omicron wave when the message was to stay home and avoid that, and a lot of settings were closed. And that's, of course, now on its way back up to recover to where it was previously. So, I'm really thinking hard about the science table as the best modeling we have of where we're headed. And it looks like we are, trending along this green line. And in Niagara, we're starting to see some of the signs of flattening out, even if it's not necessarily there in the province. And so we are potentially looking at a small rebound in hospitalizations, but largely a plateau where we likely have high levels of hospitalizations and probably high levels of infections as well in the community. And that is what we are going to be grappling with for the coming months as things stand. Obviously, if things continue to reopen, there's every possibility that maybe this starts to go up even more, and we don't stay in that plateau and we start to see infections and hospitalizations go up. And I think it's important to note that there are some real costs to choosing an option here. While this might not be, on its way up, we might not be overwhelming our healthcare sector, and they're able to restart some of their surgeries and other procedures that have been canceled. Obviously, if they remain very busy with COVID-19, they're going to have only minimal capacity to pick up on those surgeries. And there's a big backlog of people who need care. They're not going to be able to deliver care because they're going to continue to be focused on making sure they can manage this high level of COVID-19 hospitalization. I also note that when we look at the provincial data in hospitalizations, there's of course been a big increase in children being hospitalized. And so when we deal with high numbers of hospitalizations, a big burden of that is actually going to be amongst children who in many cases are still not yet vaccinated and can't be vaccinated. Especially if we look at this dark red region here, which is children under or equal to 1 year of age. So in their first couple of years of life, they actually make up half of the hospitalizations that we're seeing amongst children. And so there is that very real cost to, continuing to just live with high levels of infection and hospitalizations. I want to just take a moment here to compare what COVID deaths from COVID infection have looked like compared to influenza infection. So this is, basically what we expect every year in terms of pneumonia, influenza, and COVID infections going up to pre-2020. And, you can see there's a seasonal pattern where, of course, it goes up in winter, down in summer, up in winter. And then this yellow bar here is the number of influenza deaths we can have. And you can see every winter, sadly, there is a wave of deaths from influenza. And then what we saw in the US here during the pandemic, this is US data, is of course huge numbers of people getting COVID infection. And so these big blue, spikes of deaths from COVID-19. And it's of course just, very easy to see that the deaths from COVID-19 are on a completely different scale than deaths from influenza. This is a far more deadly infection, and an infection that I think is going to be a real burden on our healthcare system, and of course going to cause persons to continue to die. With the benefit of vaccination, fortunately, we're going to see a lot fewer people passing away, but nonetheless, with such a deadly disease, I think we need to be prepared that we are going to continue to see a lot of burden from COVID-19 going forward. This was some data done out of UK, and it's looking at how much more deadly has COVID-19 been than influenza. And you can see we started off with about 20 times more likely people were going to die of COVID-19 than influenza. As we got vulnerable groups vaccinated, we really brought the rate of death down because the people most likely to die were fortunately really well protected. And with booster doses, and then with the Omicron infection being slightly less severe, we've actually seen that rate of infections coming down. So now we're probably at about 1.5 to 2 times as likely is someone to die from COVID-19 as they are from influenza. But that I think still highlights that even with vaccination and even with Omicron being milder, COVID-19 is going to remain a deadly infection in our society, and it's going to cause many people sadly to pass away. And I think we need to be planning for society to be able to manage that going forward. This is what daily deaths have looked like in the province. Fortunately, we have peaked and we are coming down, but as you can see, our deaths are still quite high in the province, certainly higher than they were in the third wave at this point. Fortunately, much lower than the first and second waves, which were really driven by deaths in long-term care, and thankfully with 4 doses in many cases of vaccine delivered to long-term care residents, we're not seeing those deaths, but we are seeing deaths of people out in the community who are being affected. So that is going to be an ongoing struggle. And then just very quickly showing the deaths here in Niagara from COVID-19, and we can definitely see, deaths are still much more common now than they were, back in December, for example. And I think that's due to, of course, the high levels of infection we're seeing now. COVID-19, though, isn't just about those hospitalizations and the deaths. Of course, people who get infection and recover in many cases go on to suffer from long COVID. And there's been estimates that on the order of 10 to 30% of people are going to continue to suffer from long COVID. And so we should be mindful that sticking with high levels of infection in our society means hospitalizations will remain high. Our hospitals will continue to struggle. We're going to sadly see lots of people dying in our society. And the people who do recover from those many, many COVID infections are in some cases going to continue to have some lingering symptoms, which is going to mean they need to use healthcare more to deal with some of these long-term symptoms, as well as, of course, they're going to have a much lower quality of life. And I think we, need to really think about how we try and bring COVID-19 infections down for the long term to make sure that we don't have as much risk. I won't go into details around that. I talked a lot about that 2 weeks ago at our last media briefing of how we need to start to rethink about how our society is structured in some ways to take everything we've learned over the last couple of years and really implement it so that we can, in a sustainable way, reduce the risks of COVID-19 into the long term. The one option I do want to talk about, though, is vaccination, because I think this is the one that we can do right now, and it's going to have the biggest impact on us. And the science table very helpfully released this data last week, showing that if we increase from doing 8 million boosters by the end of February to 10 million boosters by the end of February, the trajectory of some of these curves changes. So rather than this red curve leading to a big spike in hospitalizations, it becomes a much more manageable spike. Obviously, we're trending on this green scenario where there would be a small increase in hospitalizations, and getting more vaccines out would mean that we would actually plateau and might even just start to see a small bit of decline by the middle of March. And so I think this really speaks to the importance of vaccinations moving forward. We can see as we've gotten booster doses out, we have seen people's risk of getting infected with COVID-19 become less. People have gotten more and more protection from infection. Over 60% of the population as a whole is protected from infection given the vaccinations delivered so far. And of course, booster doses have been a big part of that. And booster doses are continuing. So hopefully we'll continue to see that number go up. We've seen the risk of hospitalization is also decreased with more protection against hospitalization with booster doses. And of course, people who are vaccinated remain far less likely to end up in an ICU. And so, getting those vaccines out, first and second doses, if they haven't been done, but at least booster doses otherwise, is going to be a big part of how we minimize those infections, minimize those hospitalizations, and that real severe illness that causes death from COVID-19. And I also note that people who are vaccinated seem less likely to get long COVID. So it's going to prevent us from that. And so one of the ways we'll deal with COVID-19 sustainably in the long term is to make sure everybody is getting their vaccinations and their booster doses so that we don't need to do as much remaining in our society to sustainably control COVID-19 going forward. I do note, though, when we look at our vaccine uptake, you can see there's been a pretty sharp drop off in recent weeks in terms of people getting vaccinated. And I think that's perhaps partly a reflection that there's, proof of vaccination being eliminated in parts of the country. And now that's happening here, a message is probably being set that vaccination is no longer that important. We think we can be in high-risk settings with people who are unvaccinated, and that's not a worry. And so that's, I think, sending a signal that vaccination is less important, when I think, as the previous slides have shown, vaccination is more important than ever, because we're not going to have closures of these high-risk settings. We're not going to have a lot of other measures in place to really keep us safe, and we need people to be vaccinated to make sure they are going to be safe going forward. Our vaccine uptake is continuing along. Orange are our first doses, blue are second doses, and then these are our booster doses. You can see well over half our adult population has gotten their booster dose. So the majority of people in our society have made the good decision to get a booster dose. People have only 1 or 2 doses or no doses at all remain now a minority in our population. And we've had great uptake by our older ages, but we need to continue to get that up. And I think the real key here is our younger age groups. These are age groups who often are out and about the most. They're in workplaces, they are in universities, they're often in social settings, and are often the groups who are spreading infection. And if we can get their booster doses up and even their first and second doses up, that can hopefully make a real big difference in terms of vaccinations going forward. The province has mentioned that proof of vaccination is going to remain an optional requirement for people going forward. And I'm going to posit that if it remains an optional requirement, we should maybe update that proof of vaccination requirement to acknowledge booster doses as well. So you would, after 2 doses for the first few months, you'd be fine, but at some point it would require you to get that booster dose, so we can still keep getting that green check mark if you want to enter in settings where the operator has decided they want to see proof of vaccination. And I think that's just to make sure that we have people who have this level of protection from spreading infection to others, rather than the much lower level of protection we see with 2 doses after a few months. And I would recommend that that be something that province does going forward. Obviously, as we try to get vaccinations up, we're going to continue to run vaccination clinics here in Niagara. We're at the Canada One Outlet Mall all of this week doing vaccinations. And as you can see, we also have a few pop-up clinics. Today we're in Wainfleet. Over the next few days, we'll be at the St. Catharines Kiwanis Center. End of the week, we'll be in Port Colborne. And then in the weekend, we'll be in schools in Smithville and Fort Erie as well. And so with that, I'll stop and turn it over to some questions.
Okay, so first up we have Dawn, and you should be able to unmute. Oh, sorry, I meant Gord. You should be able to unmute.
Hi, thanks. I'm just wondering that there's been, the death rate obviously has been pretty high throughout Omicron over the past few months. And it's mostly been in seniors 65 and older, and especially 80 and older, which is the highest vaccinated rate. Do you have any data as to how many of those were unvaccinated versus vaccinated?
I don't have that data handy, so I can't comment. It is disproportionately compared to the vaccination rate unvaccinated people. So, if we're looking at 95% of that age group or above is fully vaccinated and under 5% are unvaccinated, it's far more than 5% of them have passed away. But I'll need to get back to you with what the exact breakdown looks like.
And just while you were touching on this, I was taking notes, so I might have missed it, but by eliminating the vaccine passport, the requirement at the start of March, how hard is that? What's that going to do to the effort to get more people vaccinated? It's sort of conflicting messages, isn't it?
Yeah, it very much does seem to be a conflicted message. On the one hand, the province is saying that it's fine to go into high-risk settings without vaccination. You're not really at any great risk, and you're not putting other people at risk. And at the other hand, they're trying to say everybody needs to keep getting vaccinated because it's really important to protect yourself. I do think it's a really conflicted message. My view is that we're in a precarious situation. I've shown that infections remain high, hospitalizations remain high, deaths remain high, sadly. We're seeing that the modeling shows that we may actually plateau at a high level of infections and a high level of hospitalizations. And taking away things too quickly puts us at risk of those going up. I can understand, capacity limits, those sorts of things are quite onerous and economically harmful. I think proof of vaccination, though, is not harmful. I think masks are not harmful to people. They're a bit of a nuisance. We can go around, continue to have those. And I would really strongly recommend that we keep those in place and actually strengthen the proof of vaccination to include booster doses, because as the data shows, the booster dose is what really leads to your risk of spreading infection and being infected going down. And if we want to create safe spaces where people can go about enjoying themselves, supporting our businesses in the community without the risk of infection spreading, I think having that booster dose will make that space the safest. So I really do think we should stick with proof of vaccination as a measure ongoing. And if the province is really hell-bent on getting rid of it, at least let's incorporate booster doses into the proof of vaccination, because obviously a business who keeps proof of vaccination is trying to keep their clients and their workers safe. And so let's give them a proof of vaccination credential that actually gives them the best opportunity to keep their clients and their workers safe.
Thanks.
Thank you. Up next, we have Abigail, and you should be able to unmute.
Hey, Dr. Hergy, it's Abby from Niagara this week. My question is similar to Gord's. I was basically just going to ask you if you think the province's announcement today is a little bit premature. Or should we wait longer to remove the vaccine passport situation and wait longer to open up capacities and that sort of thing? Or do you think now is a good time?
Yeah, so, I think the province outlined a framework previously, and they outlined in that framework that we needed at least 3 weeks between each reopening to really assess what the impact of that reopening was. I think even that is a relatively aggressive metric because many of the metrics we have are really delayed metrics. Changes in hospitalizations are going to lag several weeks after a change in terms of restrictions. Ditto with deaths. Wastewater is something that we'll see a relatively quick impact on, but that's the only metric that we can really see early on. And so the province moving up from using that 3-week timeline, which they said was the bare minimum necessary, and now doing it in a little over 2 weeks, I think is really moving it up farther than was, even they themselves thought was reasonable a couple of weeks ago. So that I think concerns me. And now, of course, it's going to be, I think, 11 days between February 17th and then dropping proof of vaccination and everything else, which again, I think is going to be far too soon to really know what the impact of the changes on February 17th are going to be. So I do think that if we're trying to be prudent and cautious, make changes, see what happens in the data to decide if it's safe to move forward, I think this is far too aggressive a plan. The other thing I'd highlight is that, we want to be looking at the science, we want to be looking at the modeling of where are things headed so that we know what is going to be the impact of the decisions we make, and is that impact going to be something that makes sense. The science table modeling shows that the January 31st reopening had the potential to see a resurgence of cases or at least a plateauing. Fortunately, we seem to be heading more towards that plateauing, but that's the best data we have, that we are already heading towards a plateauing of high levels of hospitalizations, high levels of infections. I would want to see modeling that shows that, if we take another step of reopening, that we're not going to upset that plateauing and actually send it straight back up, as opposed to what we likely want to see, which is that if we keep taking step forwards, we can continue to see infections, hospitalizations, deaths, long COVID, all that suffering from COVID-19 continue to be relieved. And I don't think we've seen any modeling suggesting that. Maybe the province has some internal modeling, but they haven't released it to us to show that what they're proposing is going to be something that we are going to be able to manage. So based on at least the data we have, and the data the science table has put out in terms of their modeling, it does seem premature to be rushing ahead with these changes, and especially moving ahead on March 1st without seeing what the impact of the changes this week will be.
Awesome. Okay, thanks.
Any follow-up?
Nope, that's it.
Okay, thank you. So up next, we have Nicole, and you should be able to unmute now.
Thank you, Courtney, and thank you, Dr. Hergy. Going forward, what is the plan if and when another variant shows up? Are local public health units changing the way we address the virus, knowing, and I believe Dr. Tam stated this last week, that COVID will be here for months and likely years to come?
Yeah, I completely agree with Dr. Tam. COVID is going to be here for months and years. And I think also more and new variants are inevitable. We had the Alpha variant, the Delta variant, the Omicron variant. Maybe one was bad luck or two was a coincidence. I think we have a pattern that this is a virus that mutates and it comes up with new variants. And unlike influenza, where there's maybe a small amount of mutation, this seems to mutate quite significantly. And I think we can expect more variants coming in the future. What I would like to, I think the best line of protection we have against new variants is going to be vaccination. Thus far, vaccines continue to have protected us when new variants have come across. Yes, we did need to get a booster dose for the Omicron variant, but nonetheless, that vaccine did protect us. So I'd really recommend everybody get their 2 doses of vaccine, their booster doses, so that they are primed and have as much protection as possible before that next variant comes. And if it does come and for some reason maybe we need another booster dose or we need some kind of new variant specific booster dose, we at least have all our vaccines up to date, so we are ready to get that. In terms of other stuff that public health can do, we are really limited right now by the restricted testing guidelines by the province. Because so few people are able to get tested, it really limits our ability to do case management, contact tracing. It limits our ability to detect outbreaks in the community and stop those outbreaks. And so I think in terms of what planning we're going to do, we have plans that if the province did reopen PCR testing, that we would resume a lot of that work. I don't know if that's necessarily going to happen. We'll of course continue to push vaccinations as much as we can, but if as previous questions were highlighting, with a message with proof of vaccination being dropped and seemingly the implication is vaccinations is less important, I do think we're going to struggle to continue to see those vaccinations come up. Beyond that, really the only thing we're able to do at the public health level is continue to message around people taking precautions. And I don't know how effective that message is going to be when everything is opening up and it's signaling to people that it's safe to go back and resume normal activities. Especially since I think everybody is understandably really tired of these restrictions and starts to want to go back to something a little bit more normal. So I think there's limited things that we can do in public health. Most useful thing everybody can do to protect ourselves from new variants, though, is to get vaccinated.
Thank you, Dr. Hirji. And just on the safety message as well, the Canadian Federation of Independent Business, I just interviewed, and they were saying the one thing missing from Premier Ford and Dr. Moore's announcement today was safety. They're reopening, but how safe is it? So for Ontarians watching tonight, is it safe to be going into a restaurant, a gym, a bar there's no capacity limits, and then come March, no vaccine requirement necessary?
That's a really difficult question to answer. Going into a restaurant with fewer capacity limits obviously is going to increase the risk of infection spreading in that setting. As we drop proof of vaccination requirements on March 1st, now we can have unvaccinated people who are more likely to be infected coming into those settings and spreading infection. So I think, absolutely, it's going to become less safe to go into these settings, especially if our infections remain quite high, which is where they are right now, and we're probably heading towards a plateau. I think the big thing, though, that will keep people safe when they go into these settings and resume social life is if they are up to date with their COVID-19 vaccines. If they've got those 2 doses and at least recently had them, or if it's been a bit later and they've now gotten their booster dose, I think they can feel reasonably confident they are going to be, reasonably safe going into these settings. There is going to be absolutely some risk. Some people are going to get COVID-19, but with those vaccinations and that booster dose, hopefully that infection is going to be mild and they aren't going to suffer any particular severe consequences from it. Obviously, if we kept proof of vaccination going forward and strengthened it with inclusion of booster doses, that would mean everybody in that setting would have vaccinations and booster doses, which would substantially reduce the risk. And I think that would be the better approach for us to be proceeding with reopening, where we lift the economically harmful restrictions like capacity limits, but we keep the restrictions that really protect people with minimum impact on the ability of the business to operate, such as proof of vaccination and strengthened proof of vaccination with booster doses.
Okay, thank you. Up next, we have Penny, and you should be able to unmute.
Thank you. I think my question was actually just asked and answered, but Dr. Hirji, I'm going to ask you to answer it in a slightly different way. Your Section 22 and your ability as regional public health would not allow you to do anything that might counteract the restrictions that the province is lifting. For example, you cannot ask that vaccination proof is required if the province is saying that it is not?
I wouldn't say that's correct. It is possible for public health to put in place local orders or local legally binding instructions to require proof of vaccination or stronger proof of vaccination. I think, though, our role in public health shouldn't be setting, broad regulations for all of society. It's really about addressing, specific patterns of infection we're seeing spreading and putting in targeted measures there. That's how we, came up with our Section 22 order in restaurants. We are seeing a pattern of infections there, and we put a measure in place. A couple months ago, when we put in place our instructions on fitness facilities, gyms, that was, again, in response to a targeted set of risk that we are seeing where infections are going up in that setting, and it made sense to do that. I doubt the province opening up PCR testing so we can start to really detect those patterns of infection again and where it might be spreading. It's not really going to be possible for us to identify those targeted locations. And I don't think it's really justified for local public health to be going off and setting these broad society-wide rules. I think that's really more the purview of the province. So theoretically possible we could do it, but without any kind of local data really pointing to areas that it makes sense to target with those restrictions, I don't think it's likely we're going to be doing those kinds of measures.
And a follow-up?
No, that's okay. That answered my question. Thanks very much.
Thank you. So we've come to the end of our first and follow-up questions. If anybody has a second question that they'd like to ask, you can let me know in the chat and we can unmute you. Okay, I'm not seeing anything pop up in the chat, so I think we're done for today. Thank you everyone for attending, and we'll see you again in a couple weeks.